Digital first is a mindset and culture that centers around the ability to communicate with those who need our information in the most effective and efficient ways possible. It goes beyond simply disseminating information. In a digital first culture, the central tenet is to understand the needs of our audiences and to adapt communication efforts in order to meet their needs. At the U.S. Army Public Health Center, our primary product has increasingly become our knowledge. As the public health environment and our role in the Department of Defense have transformed, so have our audience's expectations for how they both receive and interact with information. Our audiences are information consumers. They expect up-to-the-minute information that is seamlessly available to them via whatever channel is most convenient for their task at hand. People tend to trust the first source of information they encounter, and they make a judgment call on the relevance of that information in a matter of seconds. They quickly abandon sources that do not address their needs or align with their current beliefs. In today's fast-paced information environment, meeting the needs of our audiences can be a challenge. We must compete with and distinguish our information from all the other content available to our customers. The Veterinary Services and Public Health Sanitation Directorate has begun this effort and taken the first steps on their own digital-first journey.
Imagine trying to get a worldwide organization moving in the same direction with the same shared understanding of what right looks like, while also inspiring trust as providers of superior veterinary medicine, food protection, and veterinary public health for the entire Department of Defense. Now try to do all that while operating 137 veterinary treatment facilities, conducting commercial food protection audits in 82 countries, and without having command authority over 4 independent regions spanning the globe. This would be a monumental feat for any organization. That is why 6 years ago we started a collaboration with the Public Health Communication Directorate to develop useful and easily accessible health education materials for the customers of our Army veterinary treatment facilities. And 3 years ago, we invested countless hours harnessing the power of our own data to learn where we can improve.
In 2013, the Veterinary Services and Public Health Sanitation Directorate and the Public Health Communication Directorate collaborated to conduct a veterinary facility needs assessment for future client education materials in order to identify if there was a need for U.S. Army Public Health Center created education materials for veterinary treatment facility customers. Results from this assessment indicated a need for standard, high-quality products, and a partnership was started. Clients benefit from and expect pertinent information to support the safety and health of their animals as part of the high-quality veterinary clinical services they receive at veterinary treatment facilities. Health communication specialists and visual information specialists worked with veterinarians to develop and distribute a suite of health education materials for veterinary treatment facility customers. At the start, print products were created and shipped directly to the veterinary treatment facilities for distribution to their customers. This was done to save time and effort. Social media was also used to promote the products at this time. The MilPet Ed app was created in 2017 as a way to provide high-quality information to veterinary treatment facility customers year-round in an easily accessible, convenient format. This app also included a section to help military members quickly find the closest veterinary treatment facility. The initial product line has expanded, and today, the One Health Division has created a comprehensive suite of information materials for its customers, including brochures, information sheets, posters, veterinary connection newsletters, kids' coloring pages, tabletop displays, and the MilPet Ed app. Since the start of this collaboration, the reach of materials has been impressive. Print products have been ordered over 500 times, 13,000 products have been ordered, and 800 products have been downloaded on the Health Information Products catalog. In the fiscal year 2019, veterinary social media content was seen 68,000 times by 49,000 unique users, and people interacted or engaged with the content 2,300 times. The Interactive Veterinary Treatment Facility Locator webpage was viewed approximately 12,000 times during fiscal year 2019. Links to these pages are included in products and social media posts. The MilPet Ed user base and engagement more than doubled in fiscal year 2019. The top 10 articles had 2,000 users who viewed an average of 3 separate articles and returned to the article an average of 8 times, resulting in 56,000 unique interactions with the application during fiscal year 2019. Each time a user opened the app, they spend an average of 4.3 minutes consuming content. Since 2016, we in Veterinary Metrics have invested countless hours harnessing the power of our data in order to tap into the potential of our most important asset, our people. By providing sound data and timely analytics, we enable leaders to make informed decisions in order to optimize the support provided worldwide by U.S. Army Veterinary Services. Using the latest technology in data visualization, a software program called Tableau, we are able to display interactive dashboards to accurately depict the performance of each public health region and activity in animal health, food protection, veterinary clinic operations, and customer satisfaction. Data collected from over 7 distinct data repositories are integrated into a seamless series of dashboards and presented on CarePoint, a Defense Health Agency SharePoint site. The data can then be viewed by leaders in the field worldwide. Within only 3 months after launching, the Veterinary Metrics CarePoint site had over 180 unique users, and the content was viewed nearly 8,000 times. Let's take a look at data for one of the Army's most important assets, the military working dog. These dogs are soldiers in their own right and receive state-of-the-art care in our veterinary facilities worldwide. Through our interactive animal health dashboard, we are able to track and report these dogs' deployability and medical status, ultimately ensuring their health and readiness to deploy alongside their handlers. Our vision is to be the best at what we do. What better way to shape the future of the U.S. Army Veterinary Services than by leveraging data from the past to steer our direction for the future?
The Veterinary Services and Public Health Sanitation Directorate will continue to be forward-thinking, from ROVR, the Remote Online Veterinary Record, to GPAWS, the government and privately owned animal worldwide surveillance, to artificial intelligence, or AI. We have only started our digital-first journey.
The Veterinary Services and Public Health Sanitation Directorate is an early adopter of digital analytics and innovative communication. They are well into their digital-first journey. The vets can serve as an example for the rest of the organization by starting with the customer and working to develop the expertise, processes, technology, and content to best reach those customers. The whole U.S. Army Public Health Center can start its digital transformation.